the invitation, and it's my first time to Bari, but it's not first time to Italy, but I'm really happy to be here. Thanks for Marina for the invitation. Thanks for Professor Wolfgang, the Shira, and all the association. It's a very nice idea about this association. So I will talk about journey about keratoconus. I'm doing this since years and years. So I have no financial disclosure related to this presentation, but these are my disclosure to companies that I'm a consultant and doing a lot of clinical trials with them since many years. So I came from Egypt, Cairo, Egypt. It's our institute in Egypt. It's a huge private institute. We are 4 branches in Egypt. And it's a full ophthalmology hospital, 7 floors. We have 10 eye theater, fully equipped Primari 700, and 4 refractive suites. We have Zeiss, motion loan, 2 Alcon suites, 1 femtocataract, 10 Alcon Centurion, 3 Alcon Constellation, G&G, everything. We have a research institute of ophthalmology in Egypt, and we are the only private institute in the whole country that had approval from the Egyptian Ministry of Health to do research work in ophthalmology. And we also have a branch in Verdada, and usually I treat, by the way, Italians, because we have huge Italian community in Red Sea, Verdada. They are doing business and living in Egypt also. I was happy before I came one day that this article was top cited, and it was a collaboration between Syrian people, ophthalmologists, Egypt, UK, and Italy. And this was the best cited, and I was happy just the day before I came, and it was a huge work in the how to detect keratoconus early. Also, before I go for my presentation, I will say about some work we are doing in education in keratoconus globally. We made the Global Keratoconus School, and it has a huge board from many countries in the world, from far to east, and this is the initial board, and it will go in the next months to increase. I think more than 10 will go to join the board, and these are all working in keratoconus. And this is the aim of this, that we build the education to teach young ophthalmologists and all the refractive surgeons who are want to make a leap in keratoconus from basic to advanced, and even this school has hands-on, and many of the companies are joining us also. We did the first one in Argentina last year during the Ophthalmo Cordoba, and it was 1 year, and it was very successful with Tessian, and it was a very successful day. Also, we are going to launch in July in Egypt, and also in Poland with Professor Anna Ruskowska and Tommy and Robert Forshu. And also we are going to launch in Romania in December with Professor Sibona. It's a huge one-day work. And we made also a huge certified, first time in the world, 3 days for all Latin America with Dr. Istian. So it's a huge work doing in keratoconus. So let's go. In my opinion, to have a good results in cases of keratoconus like this is cases before and after, and how you improve the posterior corneal curvature in many cases, either this in mild to moderate cases, and even in severe, you improve the posterior corneal curvature and improve the corneal topography, and also the high order abrasion and the spherical abrasion. We should either use the symmetrical or asymmetrical, that you change from 9 diopter astigmatism, in the second day you reach 1.5. And with a long follow-up, even on the epithelial mapping, you can see how the epithelium is improved. And this is one of the signs that you are improving in the corneal topography. And or even the posterior corneal curvature is a much improvement before and after 1 year and 6 years after. So to reach this, we should think like this. To prevent, then to manage. This is crucial. To early diagnosis is the science we still learn. To manage early better than to manage the progression. This is for sure. To manage, we should know that each cornea is different. Different in genes, biomechanics, age, sex, response to anything, and even the thickness will be different in the management. To depend on the eye is not correct, in my opinion. Why? Because the AI should be important in telemedicine, but to standardize the management is complicated. Because the factors behind that we know is little, and still we need to know a lot about keratoconus. So the best is to spread the guidelines and the consensus of keratoconus management to standardize the management. If we look to the map of keratoconus in the world, it's huge, and many countries have a prevalence more than the other. And they put a correlation between the keratoconus and vitamin D. It was so strange in the last years. And the prevalence is very high in many countries, even in Europe. And now the future is they are going to link between the keratoconus and vitamin A, D, and C. And they found that a lot of vitamins deficiency can change or can be predisposing to keratoconus. And even the thyroid hormone and sex hormones. A lot of correlation, it was not just the eye rubbing and the sun and the allergy. This is the new. And the market is paying a lot to improve keratoconus nowadays. And from 2023 till 2030, the management payment, USA is paying a huge number of dollars to reach the better and improve a lot of quality. If there is a association between ocular allergy and keratoconus, yes, yes, yes. And the eye rubbing is one of the causes that increase the progression or can initiate the start of keratoconus. So as we can prevent the eye rubbing by well treating early allergy from the start, we are going to early control the keratoconus. And as Renato mentioned, since many years that eye rubbing, and he did the Violet June that we all celebrate in many countries this time, this is a very crucial. Eye rubbing is the main cause of the progression, even if you did a cross-linking. And if you look for the lecture, there is a huge number of publications about the keratoconus and eye allergy, but it was not always mentioned. And in my opinion, the lighthouse to think like this, is it stable or not stable? And the age, because in advanced ages, like 50, like yesterday I was asked about a case here, don't touch if it's stable. Why you touch in the age of 50? He's good, he's seeing better, so don't touch. So you should differentiate between is it stable or progress. And if it's stable, go for these rules. This is, as I say, this is the lighthouse, how to proper manage the keratoconus. And nowadays, the tear film, which is now Rohit in India, a big group doing a lot of research now about the tear film and keratoconus. So just by the streak, we can early diagnose keratoconus before it appears even on the epithelial mapping. And also nowadays we can classify the stages of keratoconus according to the tissue biomarkers and the tear film. So we can differentiate between mild, moderate, advanced, and severe according to the level of the tear film biomarkers. And this is how it's going to be the future. As much as we early diagnose, as much as we reach. Also, we can differentiate the grading of keratoconus from early, no, form frost, grade 1, 2, 3, before it appears on the topography. This is the future nowadays. And this is a very nice slide that it describes well the ocular surface immunoinflammation status of keratoconus. Keratoconus is an inflammatory, and it leads to, according to the grade, form frost, grade 1, 2, and 3, and 4, according to the level of the immunoinflammatory mediators. So, association of ocular allergy and keratoconus, yes. And there is a huge number of cytokines that already produced in cases of keratoconus, and we are now detected. What about the future? The future is coming, yes. What is the future? Is the biomarkers of keratoconus. It will be like a strip that you can put it in the conjunctiva, and this is in the coming 1 or 2 years, the huge group between some Europe and the Indian group will go to describe this coming between the tear film osmolarity, and the keratoconus. And this is the coming soon, very soon. So, again, the eye rubbing, to highlight it, atrophy, ultraviolet exposure, very important. Biomarkers relation, equal allergy and keratoconus. And also what's also new now is the matrix metalloproteinase. They detected this in cases of keratoconus, and the level of the matrix metalloproteinase is one of the key factors in the early diagnosis of keratoconus. And now the eye rubbing produces all the inflammatory mediators. Contact lens wearing both leads to inflammation, and all the mediators will lead to the MMP3 and leading to the with the genetic response, they are going to be extracellular matrix and lead to the changes in the corneal biomechanics. Gelatin 1 and 3, also they are the new coming factors that can detect early keratoconus. I will pause this because, yes. Also, this is one of the new publications that it was between tear mediators and interleukin-13, and it has key factor in the keratoconus progression. And this is a very nice publication which was published in Egypt in 2022, that they made a screening panel of the topical ophthalmic medications against the MMP2 and the MMP9 to investigate their potential in keratoconus management. Also, I'm going to highlight something about artificial intelligence with the deep learning, that there is a very nice device. It's a very, very simple device. I will pause this. Yes, it was a big group, Renato Ambrosio, since many years, was doing a huge work with the artificial intelligence from 1997 till now, and the new device of the Oculus that will go, I think, to be in the ESRS, the coming Copenhagen. It's a new Oculus machine with new software with artificial intelligence, and also published in March 2024. This new publications about exploring fundamentals of the future for systematic review of early diagnosis of keratoconus. It depends on the digital sizing and topographic orbit scan, the slit lamp examination, the spectral microscopy. What we did recently, published in Cornea, with a group in Italy also, with Massimo, with Cosimo Mazzotta, with Professor Giuseppe also, Adapo, the ray tracing, how we transclear excimer laser central corneal remodeling, and this was changing in the cornea, how to treat, or how to regularize the cornea according to the whole corneal topography, the anterior and the posterior, including the corneal thickness. And also we are doing a lot of changes now, not only the Kairos by Susan Jack, but now we are cross-linking the Kairos. And very soon we are going to publish the new effect of cross-linking of the Kairos before we introduce into the corneal canal. And this will make a change also in the effect of the Kairos changes. This is a special group is now in the States doing huge work in Brilliant microscopy, using the Brilliant microscopy, and to detect the early changes in the corneal stromal structures in keratoconus. And this is a very special group in USA now. This is what I'm highlighted. This is a very cheap machine. It's an AI machine. It's called the Topo Eye AI application. It is just $4, and you can screen in your clinic if you are in an area far. You can, with this, just the Topo Eye, you can screen the corneas, and you can detect early changes with this machine. Finally, I am happy that we did a huge work in the last 3 years with Cosmo. We published a huge number of publications in keratoconus, and also in the cross-linking and the protocols of long-term, the 9 milliwatt. It was highly cited publications in the last 3 years. And also this book, it was published since 2 years, and it was the highest book on Springer. 10,000 was sold in 1 year, just 1 year. So my take-home message is the biomarkers are essential to customize treatment. They represent the benefit for doctor and patient immunoglobulins. And also the more accurate keratoconus detection requires both clinical judgment enhancement and improving the quality of machine learning algorithms. Using the AI in genetic and marking evaluation and longitudinal corneal data may predict future disease progression and identify which eye may be benefit for early intervention. Thank you so much, and just I am going to leave you with this video. This is just for Italians. This is our new Egyptian museum. It's open. It will be opening soon in July 3rd. It is the biggest museum in the world for one single civilization. It's in Giza, just in front of the pyramids. It is just glass, and I am inviting all the Italians. They should come to Egypt to see this, because it is a state of art between 4 countries in the world made this museum. It has no walls, just glasses, and during walking inside the museum, you can see the full pyramids and the Sphinx. And this has never happened in the world before, and it will be a great celebration in Egypt with all the presidents in the world will come to Egypt in July 3rd. So I hope everyone to be here. This is the Egyptian Grand Museum. This is amazing work. It's a huge building. They changed the area. We changed the area at all. If any come to Egypt before, it's a totally different area now. And you should all come to Egypt to see this. It's no museum in the world like this. The sun is from everywhere inside the museum. Whatever you walk, you are going to see the sun. So enjoy Egypt. Thank you so much.